Hello. Today I want to talk to you a little bit about managing pain. So, if you're a person that struggles with an injury or a previous injury, if you have chronic health issues like I do, so I have fibromyalgia and arthritis, or if you're just somebody who's active and you want to make sure that you prep and recover really well, this modality is my go to. It's for everyone. And the thing is, if you have a chronic condition like I do, so let's take fibromyalgia, and I know that pain is going to be part of my life. And I also know the things that might trigger it. And then there are situations where I might get a flare up or the pain is unexpected and I need a way to manage it. And for myself, I'm not a huge proponent of taking medication for that. I would rather try and do things naturally and through other ways. So foam rolling has become really important in my life. And so I want to tell you a little bit about it. I'm going to teach you 5 different ways to foam roll. And the reason I'm doing this video is because many people foam roll incorrectly. They don't do it the right way. They do it too fast. They don't have the right technique. And you need to make sure that your technique is good so that you reap the benefits of actually foam rolling, because otherwise you're just kind of wasting your time. Okay, so the first thing I want to talk about before we get into the rolling and the techniques is that I prefer Trigger Point products. And the reason that I do is they have research behind their construction of their products. So their foam rollers have a hard core in the center, plastic core, so it doesn't break down as quickly as the ones that are complete foam. The other thing is this foam roller can hold up to 300-pound capacity. It's been tested even higher, but they say 300 pounds. And the different shapes on the foam roller are different densities. So this big flat area would mimic the density of a palm if I were getting a massage. The longer ones would mimic the density of a finger if I were having a massage. And then these ones are the density of a fingertip, these little ones here. And so when you roll on Trigger Point foam rollers, they feel completely different than other rollers. I have other rollers, I've tried other rollers, and it just doesn't feel the same. The thing is with foam rolling, it's quite intense, and it can be. So you want to make sure that you're not in pain when you're doing the foam rolling, because you want to actually continue the rolling. Okay, so the benefit of foam rolling is that when you roll over these trigger points, or they feel like knots to me, in your body, you're putting fresh oxygenated blood into those blood cells, and it's helping the fascia get healthy. And so the fascia is the connective tissue in our whole entire body, and the way that fascia should move is it should slide nicely, and so that allows us movement, right? But when we have an injury, or when we have, overuse strain, or something happens, we get that trigger point, that knot, or stress. This is a great example. Stress definitely creates those knots in our muscles, in the fascia. What happens then is there's not blood flow going to the area. And by rolling gently and using this foam roller, we get the blood into that area, and then we slowly start to break down fascia. Now, research shows fascia takes between 7 to 12 months to break down. So imagine you have a knot, let's say in your back, and it's been there for a really long time. You're not going to have 1 or 2 rolling sessions and then everything will be hunky-dory and the knot will go away. I mean, maybe you'll be lucky and it will happen that way, but the reality is it probably will take some time, and it will take daily repetition. Now, the thing about foam rolling, you don't have to do it for a long time. So you could do a couple minutes in the morning, a couple minutes at night, and you're done. So it's not about, the length of time on the foam roller. It's about the consistency, which we know is with everything, right? Okay, so we're going to go through the 5 different ways of foam rolling. The keys that I want you to think about when you do your rolling is, number 1, you're going to make sure that you can breathe. Number 2, you're going to make sure that you go slowly. Okay, those are kind of the key things. Oh, and number 3, you're going to make sure you're going to cover about 1 to 1.5 inches of area. That's it. So when you see people foam rolling like their whole entire leg, this is not the correct technique. Nothing is happening there. Remember, you have a knot and you want to get blood flow into the area so that the knot eventually releases and then the fascia starts to slide, right? Because it's not. It's sticky, it's stuck, and that it's like Velcro. Okay, we want to free it up. All right. So first technique that we're going to do is just a hold. So, as you start to roll, you will start to feel on your body. You'll know where you have knots, where you have those trigger points. And I know on the outside edge of my leg, up near the top of the calf muscle, I know that there's a knot there. There always is. My foot is doing nothing. Okay, it's just relaxed. It's not in the video because I'm not rolling it, so I just want you to see this part. All I'm doing is sitting on the roller. This is a static hold. If you want extra, you can cross the other leg over top. If you want even more, you could lift yourself off the ground, hold yourself up with your hands, and then that actually adds more compression to the foam roller. Okay, so that's the first one, just a static hold. Okay, number 2, we have the roll. So this is the one that most people know about. And I want you to notice how little space I am covering in that knot. It's literally 1 inch. It's very, very small. I'm not rolling my whole leg. I want to be very focused on the area where that knot is. So it's just a little bit of movement, okay? And again, if I want more compression, I can put that other leg on top and then push into it and roll, okay? The third way that you can roll is you can roll the muscle and roll over the knot side to side. So I'm rotating from my hip, okay? So I'm rotating open and close. So I'm going to show you, I want you to see my foot. So I'm rotating open and closed. So I'm going over that knot nice and slow. Feels kind of like a speed bump, all right? That's method number 3. Method number 4 is now we're going to slide the muscle. So the one before, the side to side roll, I was actually rotating my hip open. So this is what I'm doing, right? I'm rotating the whole muscle. This one, I'm pushing down and I'm sliding side to side. Okay, so think about you're squishing a bug. You're doing this. This is the movement. So I'm digging in and I'm pushing. So my foot is not rotating open like it was. My hip is not moving side to side. I'm just rolling and pushing down over that knot that I have found. And then the last method is a contraction and a release. So I'm going to contract the muscle and then release it. So I'm going to gently flex my foot and then I'm going to release. So what I'm doing is I'm actually moving the muscle while I'm on the roller, while I'm on that trigger point, that knot in my body. Okay, and you can move it different ways. Like I can move the muscle. I can make circles with my leg. It's all about moving that muscle while you are applying pressure on the foam roller. So those are the 5 different ways that you can foam roll. You can roll all different parts of the body. You will not roll the neck. You will not roll the organs, okay, in the low back, and be careful behind your knee because there's a lot of ligaments and tendons in there. So we want to be careful of that. But other than that, you can roll any part of your body that you want. Like I said, you could do 5 minutes and do your whole body. You don't have to take a lot of time. And this is the thing I want you to remember when we're talking about rolling. Okay, rolling is fantastic for keeping the fascia healthy. If you have a chronic condition like I do, like fibromyalgia, what is happening is that you need to make sure that your body, your joints, your muscles are healthy, okay? And the easiest way to do that is to make sure that you are keeping them healthy, keeping them moving, and keeping the healthy blood going in. And the best way to do that is to do it through foam rolling. If you are interested in more foam rolling information, I am holding a workshop on Tuesday, October the 6th at 7:30 p.m. Eastern Standard Time. We will be doing it through Zoom. And if you are interested in coming to the workshop, please let me know. I'm happy to give you the information for the meeting room. The investment is $10 a person, and we will go through various body parts and I will show you how to roll them. So hopefully that was helpful. Hopefully you learned some information about foam rolling. And as always, if you have questions, please feel free to reach out.